Dental Nachos is here to ABC, always be connecting to help you feel less alone. I'm so glad to be chatting with Dr. Danielle Bond, a dentist that switched careers due to a mental health challenge. This is Mental Health Awareness Month. The discussion of the stress and challenges in dentistry is so important to me and this Nacho community. I'm so glad to have her on, sharing her story. Dr. Danielle, thanks for being here with us. And let's start with your dental journey. Where did you go to dental school? When did you graduate? Tell our Nacho community a little bit about that.
Sure. Thank you so much for having me, Paul. I graduated in 2015, so not too long ago. And after that, I did a residency at the VA in Rhode Island. Oh. That was a GPR for a year. And then from there, I practiced in private practice in Massachusetts. That's where I live now. And I actually practiced in my hometown. So I was seeing my old guidance counselors and teachers. It was a really great experience.
I actually, same thing for me. I practiced in the town I grew up in. So I see my gym teacher from the 80s say, look, I'm doing an implant on you now. It should have been nicer to me back then. And we joke around with that. So I think that's a really cool experience. One thing I always share with my wife, I just interject with good ideas. I don't interrupt, is my joke. Tell the audience, what was the value of that residency year from dental school to the real world? Did you find that to be helpful with experience, confidence? Tell me a little about your residency.
I absolutely loved my residency. I think working with the veteran population was very rewarding. They were just a super appreciative, kind group of people that really needed dental care. So it was excellent. And I felt like I had two amazing co-residents that were still friends to this day. I watched their kids. It's great. But it was great because it allowed me to get faster. You weren't doing those 3-hour fillings like in dental school. And I felt more confident with emergency surgeries, stuff like that. I got to do some perio surgery, got to kind of do some things that I wouldn't have otherwise have done.
That's such a good point for our community to hear. I did a multi-year general practice residency, and I believe it was my 30th birthday. The trainer from my high school said a girl on the field hockey field got hit in the face with a stick. Her teeth are all over the place. And I said, send it to my office, because I was totally comfortable assessing that. I was totally comfortable having someone coming in with a bloody mouth, crying mom, all these things, and getting her the place. So really doing things that you're not going to do every day in private practice only makes you more confident in private practice. So I appreciate you sharing that. I want to catch our viewers up. This is Mental Health Awareness Month. Our partners and sponsors at the Dental Success Network have an amazing opportunity when you join the Dental Success Network to get a free month of Talkspace. My team will share that in the comments. You can also text DSN to 215-543-6454. So now tell us, you graduate from your residency, you work in a private practice after that, and just it's your floor to share with us. Tell us what's going on when you're doing it. Bring our audience back to that time and tell us about it.
Yeah, absolutely. I practiced from 2016 to 2018 in private practice, and it really was an incredible opportunity I was presented because the owner of the practice was so supportive. I was a brand new, associate coming out of school, and she actually physically expanded the practice to be able to incorporate me, which I was so appreciative for. I had a large patient pool. Everything was going well. And I was kind of at the pinnacle of everything I ever wanted. It was so wonderful. But unfortunately, I had to take a step back in 2018 from practicing due to my mental health condition. And since that time, I had to take a couple of years for rehabilitation for some mental health help. And I had to make the very, very difficult decision during those few years to not return to dentistry. I just felt that it wasn't best for my mental health going forward. So now I'm actually pursuing a master's in food and nutrition to become a clinical dietitian to help people manage chronic disease.
That's amazing. I share with a lot of people. I get a lot of parenting tips from TikTok, Danielle, and I like those videos. And there's a parenting video that says we should reframe how we talk to our children. Instead of saying, I'm so proud of you, we say you should be proud of yourself. So you should be proud of yourself for being here, talking about this, because I know somebody listening, watching the future is feeling this. Can you walk us through? And ABC always stands for always be curious. So I hope I'm asking questions that are curious about this. walk us through your in practice and what did it mean that your mental health challenges were affecting your practice? And if you want to share the resources you went to, the doctors that you went to, any of the diagnoses to help people, feel free. But tell us a little bit about how those feelings, you're in practice, this stress is more than normal, this isn't right, it's affecting me too much. So tell our audience a little bit about that.
Absolutely. That's a great question. I think that, by all intensive purposes and measures, I had what, I had set out to have. I felt like I had accomplished what I had set out to accomplish, but I was still so sad inside. And I know that sounds crazy, but I just felt that, I was absorbing patients' anxieties in the chair during the day. And as I'm sure you can relate to, Paul, it's, it can be tough because you're in a negative environment just because people don't want to see you.
Yes,
they don't want to see us, which I understand completely, but I am an empath. So I was absorbing that. So I had really terrible anxiety during the day. And then at night, I wasn't sleeping. After a while, I stopped eating. So I lost about 20 pounds. And when you're not sleeping and you're not eating, you're going to suffer. So that's what I was doing. I was suffering. On the weekends, I'm a very social person. That's why I wanted to be a dentist in the first place. So on the weekends, it was my now husband couldn't drag me out of the house. I just wanted to be in bed all weekend. And after a little while of dealing with that, I said, oh boy, I think I need to go get some help.
And
so I went to
I appreciate you sharing this so authentically. Just tell us about that getting help, right? So one of my most favorite people on the planet, Carol Kilvar, she was watching this when we were younger, when I was 10 years old or 12 years old. She was hospitalized with a mental health disorder at the time. She was a big proponent of NAMI. She works for NAMI. I'm so honored to be her friend. So we talked about, getting help. What did that mean? How did you even know who to go to for help? What resource go? You have this feeling. Where did you go?
Yeah, that's a good question too. So the first person I went to was my primary care provider. And I think that was a good first step, but I think it was a challenge because she listened to me for 5 minutes. She told me to look at the flowers. She said, it sounds like you're depressed. And she handed me medication. And I am, personally, I'm on psych meds now. I'm a supporter of medication. But she didn't know enough to be able to diagnose me properly. And so what that ended up doing was that exacerbated my mental health symptoms. So for the first week, I was going through mania where I was actually running laps around the dental practice, pressured speech, meaning talking really fast. And then I would crash into depression where I'd be in my car between patients crying, plotting my suicide. It was awful. And I tried to get a hold of her to tell her about the side effects, and I couldn't reach her. So I think from there, it was actually my boss who connected me with my first therapist who also could prescribe medication. And so it began this trial and error of trying to find what was going to help. And I wish I could tell you, Paul, that it was one thing that helped me get better, or it was one provider, but it took me about 3 years of trial and error with different therapists, different psychiatrists, and I just didn't want to give up. And I think truly being a dentist saved my life because I looked at myself once I could come up for air and I was stable as a patient. I was a trained clinician. And so I said, how can I help myself? What can I navigate to be able to fix this or at least manage this, Yeah.
I think really appreciate you sharing that journey. And what piqued my curiosity was, even from you get people get medication, think they're going to be better. And then how did you realize, was it someone from outside your life, a husband or a friend, that this medication wasn't making you better? Or were you able to realize that yourself?
I realized that myself because, and I just knew that I wasn't functioning properly. And it was very quickly after those side effects from that medication that I pulled myself from practice. And I think it was really, 5% for me and 95% for the patients. I did not want to harm anyone. I knew I wasn't well. And luckily I had the practice owner was extremely supportive and understood my decision, but it was really me.
If
Yeah.
if someone was watching and thinking, I went to a doctor, they gave me medication, this kind of sounds like my story. How you said your practice owner, how did you find that magical therapist that seemed to get you on the right track? How did you find that referral, or how would you recommend someone who feels like you reach out for the right help if they were listening?
Yeah, I mean, there's several ways to find, and I want to say, first of all, I'm not a trained mental health provider. I can just talk from my own experience. But for me, I actually used Psychology Today. It's all one, you type it all in one word into Google, and they have a list of therapists. And underneath each of the therapists, it has what they specialize in terms of, which mental health disorders they can work with. And so a lot of it, honestly, was trial and error. And I first wanted to look for people who had X amount of experience, and I had like a whole sheet of what I needed in a therapist. And at the end of the day, it ended up being someone who really listened to me, really cared, and I felt comfortable with. That is huge, to really feel comfortable with someone that you can open up and share and not hold back.
For sure.
And she was able to connect me with resources as well. So she has been instrumental to my healing journey.
That's an awesome story. And hopefully that helps someone, listening in today that, they're just continue to look for the right resources. Now let's just talk for a minute or two. So you're getting this diagnosis, which you've told me is bipolar disorder. Is that the right way to, you have this diagnosis? Take us through the leaving of dentistry where you're like, I am going to stop being a dentist and going to what that was 3 years after you started in private practice.
Yes. So, I wish that there really wasn't a turning point. It was really a lot of self-discovery. I did a lot of work in therapy. And my decision.
Therapist, how does this is really just totally curious to me. The
Yeah.
therapist's role in advising, or maybe that's not the right way, how did they comment on your dental career throughout the process? Because they're not dentists and you're saying, hey, this is crazy stressful, but I bet you therapists get people every day that tell them that their job's stressful, and they must have the difficult job of figuring out, is this normal stress, healthy stress, toxic stress? So how did they comment on how dentistry might be exacerbating this?
It's interesting because dentistry, I brought up dentistry a lot, but it was helpful to have, I did lean on some of my dental friends through this. But to be honest, it was nice to have someone coming from the outside. And it was more, therapists typically, in my experience, don't comment on, this is what you should do, this is what you shouldn't do. It's more, they allow you to make the decisions on your own. They're trained to be able to give you the empowerment to empower you to really make those decisions. And so I think it was really me that made that decision, and it was self-discovery over time, because I think that dentistry really, because we're working in terms of millimeters, it really does fuel a perfectionist type A, and I'm already that kind of person. And so I think that it just exacerbated my anxiety. And I fully recognize that leaving the profession is not something that everyone would want to do. But just for me, it felt like the right decision, because I really enjoyed educating patients, but the clinical work was something that caused me a lot of anxiety. So I thought to myself, what can I do in healthcare where I can really focus on education? And that is clinical dietetics.
That's awesome. Now, when we talked prior to this, I'm a big JBR, just be real story thing. So I mean this in the most curious way. You leave dentistry, how were you able to afford to continue to live in a home and eat food? Because there's a lot of dentists with a lot of debt. So how did you manage that part of it financially? Even though if this was totally the right move for your health, which it sounds like it was, you do need to continue to fulfill the basic needs of life. How did you figure this out financially?
That's the $1 million question, because most dentists are in a lot of debt, as was I. So it was a combination of many things. I was fortunate to have family support. for some of it. I was able, and because of that, I was able to put the money that I made in my private practice towards my loans to start paying them down. But also too, when I was in dental school, my roommates' parents, who are currently dentists, they encouraged us to get private disability policies.
Yeah.
So if we ever were to break our hand or anything like that, it would cover you. And so I actually was able to stay afloat for a little while with a private policy. But what was interesting about that policy is that there is a small clause in fine print that says if it's a mental health condition, there's a 2-year cap.
Gotcha.
So for anything else, it's infinite as long as your providers say you can't practice, but mental health is
incredibly unfair. And we have an amazing disability sponsor. My team can tag doctors, disability specialists. They help people deal with this. It seems incredibly unfair, but it's their rules of this disability game.
Of course.
So now you're sharing this story with our community, which is amazing. You're super authentic. You're going to be doing dietetics and nutrition. As we wrap up this segment, we'll do more. I love to ask people this. What do you wish dental students knew earlier? What's something that you would like to share that might help someone on a journey along the way, whether it's seek help earlier, sometimes stress is not normal, lean on your friends. It can reinforce the things that you have said, but just kind of to wrap up.
Yeah.
What would you leave the audience with?
I think that it's really important to have a support system. That's what got me through everything. And it doesn't have to be a parent. It doesn't have to be a friend. It could even be, I found support through mental health organizations, nonprofits, just finding something that you can be a part of. But also, I know this sounds really simple, but self-care, really self-care. I mean, when I was in dental school, I wasn't working out. I was eating whatever I could find. It's a busy 4 years. It's really busy 4 years. And just taking care of yourself, finding time to breathe. And it doesn't have to be necessarily, exercise or yoga, but just finding something where you can channel some of your energy that's outside of the rigors of dental school is really important.
Amazing advice. I want to share, Dental Nachos is a community of support. It's not a professional community for, like you have said, you're not a professional therapist. We encourage people to seek professional help if they have challenges. And I will add that we have connected people to get help. It's part of our always be connecting mantra here. I recently, Danielle, this is what sparked Jillian to reach out to me. Jillian's awesome. She was in Philadelphia not too long ago because a female dentist moved across the country away from her family, was feeling very overwhelmed in her new associate position. She said, I need help. She mentioned that she feels like she has ADHD. And not only did I have 4 dentists who were diagnosed with ADHD reach out to me and say, I will help this person. I've had at least 14 people through Instagram and Facebook say, I need to talk to those people. And this is why we do what we do, to bring these stories to our community so awesome people like you can make people feel less alone. If someone wanted to reach out to you, to interview for a podcast, find out more about what you do, learn about what it feels like not to do clinical dentistry anymore, what would be the best way for them to reach out to you?
Absolutely. You can reach out to me via email. It's I can give it to Paul, but it's dbond113@gmail.com. I'm happy to, I don't have all the answers, but I can at least, I'm happy to connect anyone to resources or, talk through anything anyone would like to share.
Awesome. Well, I applaud you for doing this. We're going to continue to do great things together. Nacho community, there are resources out there for you. Our amazing partners at the Dental Success Network and sponsors have a free month of Talkspace going on right now. That network has helped me. Danielle has said multiple times, find a community to support you. Sometimes that's in person. Sometimes that's online. Most of the time, it's both. Thanks so much, Danielle.
Thank you, Paul.